training services for Kinetic Chain in Dallas, Texas. What I'm going to show today is some self-treatment for turf toe. And what we want to do is we have three different modalities. I have number one, I have a lacrosse ball that I'm going to use to foam roll or roll out my bottom of my foot. I have some kinesiology tape, in this case rock tape, in order to provide some support and also get some brain and foot connection. And lastly, I have some TheraBand, what I'm going to use for the exercises to groove some new range of motion. So the first thing that I'll do is I'll check the range of motion of the foot and in the big toe, and what I want to see is about 40 degrees of what we call dorsiflexion, or the ability for me to pull the toe up towards my shin. So if I'm here at 40 to about there, I know that that's beyond 45 degrees, and I'm going to be good. So I have good range of motion in there. And that's usually with that turf toe, you're really feeling it in here, and because of the lack of mobility, you put excessive stress when you're trying to drive off of that foot, and that's usually really where this comes from. There can be tears in here, so you have to be careful. If you start trying to do some self-mobilization and things and it's just really getting worse, or it's not improving, then you should see a healthcare provider to take a look at that. Sometimes we need to get an MRI or something to see if there's actually tear to the capsule or the tissue that's surrounding the joint. So if you do have a lack of mobility in there, what I would do is I would use first the lacrosse ball, lay the lacrosse ball down, and I'm going to put as much pressure as I can, and I'm going to roll all along that longitudinal arch. I'm trying to relax my toes as much as I can and relax my foot, putting as much pressure in as I can tolerate, and I'm going to do that for somewhere between 30 seconds and a minute. And I'm really just trying to kind of mash that tissue. Okay, after that's done, about 30 seconds to a minute, then I'm going to come back up and I'm going to recheck my range of motion. I'm going to see how that is. If it's not quite there, I'm going to do some self-mob, pressing, lifting, I'm distracting, pulling the toe out and up, out and up, out and up. And so I'm really trying to lift that joint and create some space and trying to self-mobilize that joint. If there's any pain with any of this, you should stop. There shouldn't be any pain at all. So after I've kind of increased the range of motion, now what I have to do is tell the brain that that new range of motion is okay, otherwise things will just start to tighten up. So I'm going to use some kinesio tape, or kinesiology tape, rock tape, to do that. I'm going to take this down, lay a piece. I'm going to pull my toe up as much as I can and stretch the bottom of my foot, and then I'm going to bring this all the way around to the back, just like that. And that's going to support my arch. Lastly, I'm going to do some exercises. So I'm using the TheraBand. This is the thinnest TheraBand that I use in the clinic. And I'm going to do two different types of exercises. The first one I'm going to do is for the muscle that attaches to the big toe. So if you notice, I stepped on it and I separated this out so that the band is only around that big toe. Because if I put it around all the toes, then my little toes won't get nearly the work that my big toe does. And there's enough resistance so I can pull that big toe down to the floor. And I'm going to do 40 repetitions of that. And no, I'm not going to make you just sit there and watch that for 40 repetitions, but that's what I would do for that. And after those 40, then what I'll do is I'll switch this over, and then I'll get the band around all the other 4 toes, and I'll do the same thing. And I'm pulling up enough to provide resistance, but not so much that I can't bring the toes all the way back to the floor. If I turn, you should really be feeling this through the arch and through those little tiny muscles in the foot. And a lot of times those guys get weak because we are using a shoe that is either too supportive or the arch is not allowed to use the muscles in there as well as possible. 40 of those, both of those, I would do that every day. If you continue to have pain, seek out a healthcare professional like us at Kinetic Chain. Otherwise, good luck. That's for turf toe and some sort of big toe limitation and range of motion.